Hi, I'm Chelsea with Nourish for Life, and today I'm going to talk about alcohol intake and POTS. So this is something that certainly should be considered, especially if with patients that have POTS and mast cell activation syndrome. I recommend, of course, discussing any diet changes with your doctor. This should be something that certainly is part of the discussion if it's important to you. Alcohol has a couple of things that should be considered when you're talking about POTS intake or POTS and how the intake of alcohol affects your body. So alcohol expands your blood vessels and can increase heart rate, which of course is already a problem if you have POTS. It slows down chemical pathways in the brain. So of course, if you're already having brain fog, the alcohol probably won't help that, but did you expect it to? Probably not. It can increase drowsiness, but it also disrupts REM sleep. So while you may feel more tired and fall asleep more easily, you're likely not going to sleep as well and not get as much of that really good REM sleep. It can affect gastric motility and increase intestinal inflammation. Both of these things are not good for anyone, but especially if you already have motility issues, having alcohol intake on top of that could be, more of a problem for you. So it's something you want to consider. It also can irritate the stomach lining and increases gastric juice production. And so if you have issues, especially with acid reflux type symptoms, alcohol can be something that definitely causes more of those symptoms. So it's definitely something you want to keep in mind. It also decreases antidiuretic hormone, which causes you to lose a lot more fluid. So it works against those POTS goals of increasing salt and water to increase your blood volume and can be very dehydrating. And so certainly those alcoholic drinks aren't counted towards your fluid goal and in fact work against the fluid that you're trying to get into your body. So especially if you struggle with dehydration or getting enough fluid, if you have GI disorder, symptoms and disorders with motility, and if you have insomnia or you're having trouble controlling your heart rate, those are certain things that you would really want to discuss with your doctor before you decide yay or nay on alcohol intake. Alcohol may also be a trigger for mast cell activation syndrome, but again, this is individualized. So it's something that you should discuss with your healthcare team and base on what's important to you and what your symptoms are. I hope this is helpful. Thank you for listening. Please like and subscribe and have a great day. Thank you.